What is a migraine headache? A migraine is a powerful headache that often happens with nausea, vomiting, and sensitivity to light. Migraines can last from 4 hours to 3 days, and sometimes longer. The American Migraine Foundation estimates that more than 36 million Americans get them, women 3 times more often than men. Most people start having migraine headaches between ages 10 and 40. But many women find that their migraines improve or disappear after age 50. They generally last between 4 and 72 hours. What causes migraine headaches? Migraine headaches are a symptom of an overall condition known as migraine. Doctors don't know the exact cause of migraine headaches, although they seem to be related to changes in the brain as well as to genes that run in families. You can even inherit the triggers that give you migraine headaches, like fatigue, bright lights, weather changes, and others. Some common migraine triggers include stress. When you're stressed, your brain releases chemicals that can cause the blood vessel changes that can lead to a migraine. Foods. Some foods and drinks, such as aged cheese, alcohol, and food additives like nitrates in pepperoni, hot dogs, lunchmeats, and monosodium glutamate (MSG), may be responsible for up to 30% of migraines. Caffeine. Getting too much or withdrawing from it can cause headaches when the level in your body abruptly drops. Blood vessels seem to get used to caffeine, and when you don't have any, you may get a headache. Caffeine itself can be a treatment for acute migraine attacks. Changes in weather. Storm fronts, changes in barometric pressure, strong winds, or changes in altitude can all trigger a migraine. There's no cure for migraine headaches. But many drugs can treat or even prevent some of them. You can also get them less often by avoiding triggers. Common types of migraine treatments include pain relief. Over-the-counter (OTC) drugs often work well for some people. The main ingredients are acetaminophen, aspirin, caffeine, and ibuprofen. Never give aspirin to anyone under the age of 19 because of the risk of Reye's syndrome. Be careful when you take OTC pain meds because sometimes they can add to a headache. If you use them too much, you can get rebound headaches or become dependent on them. If you take any OTC pain relievers more than 2 days a week, it's time to see your doctor. She can suggest prescription meds that may work better. Nausea medicine. Your doctor can prescribe it if you get nausea with your migraine. Preventive medicines. If you don't respond to other treatments and you have 4 or more migraine days a month, your doctor may suggest these. You take them regularly to reduce the severity or frequency of your headaches. They include seizure medicines, blood pressure medicines like beta blockers and calcium channel blockers, and some antidepressants. CGRP inhibitors are a new class of preventive medicine that your doctor may recommend if others don't help. Biofeedback. This technique helps you recognize stressful situations that could trigger a migraine. If the headache begins slowly, biofeedback can stop the attack before it becomes full-blown. Transcranial magnetic stimulation (TMS). You place this device on the back of your head at the start of a migraine with aura. It sends a pulse of magnetic energy to part of your brain, which may stop or reduce pain. For a doctor's recommended solution, visit the link in the description.